The Supplemental Nursing System is a feeding tube device. It is used in special situations to make breastfeeding work beautifully for the premature infant learning how to suckle, the adoptive infant whose mother wants to nurture him at the breast, the baby who has had any difficulty suckling due to a medical problem, such as a heart condition or a cleft lip or palate. Or a mother may use it to begin breastfeeding again after an untimely weaning, just simply for the infant who is confused and reluctant to start by himself. Breastfeeding can be possible and wonderful, even when these situations occur.
Robin and baby Jeremy and I are going to show you how to use it. This is the Supplemental Nursing System, and quite simply, it's a bottle that holds milk connected to some very thin tubing that's very soft and flexible. And the bottle hangs around your neck, and the tubing is taped right on your breast, like this, and the baby takes your breast and the tubing into his mouth and suckles, and he gets the milk from your breast and also the milk from the tubing. It's quite easy. It comes all sterile in a package and all ready to use. So we take the bottle out, and it very, very conveniently sits right on the table, so it's easy to fill. Now, since you're nursing adopted baby Jeremy, we're going to use the milk that your doctor has recommended. And we pour it into the bottle, like that. And the tubing comes all assembled and ready to go. Now, what's unique is this tubing has a white cap, and that's for the medium flow that we generally start with. That's generally used for milk. There's two other tubings that come with the package. One has a red cap, and this is, as you can see, a much thinner tubing and provides a slower flow for the baby who needs that. And then there's a clear cap, and this has a thicker tubing which provides a faster flow for a baby with special needs or when Jeremy gets a little older and wants it a little faster. But we're going to put these two tubings aside and deal with the one that has the medium flow. And before we attach it to the cap, I want to show you how it's assembled. It comes assembled, but at some point you're going to want to unassemble it and clean it and put it back together again. And it comes apart. The white tubing fits over this little cap that really looks like a hat. And what's quite simple is the back of the tubing, where the tubing actually comes out of, has these little grooves in it, and they fit right over the hat like a puzzle. And you really can't put it together incorrectly because those little grooves fit right in to the hole, and it fits right over the hat. So it's all ready to go. Now, it's designed not to leak, but one little tip. When you assemble it after you've cleaned it, make sure that you've dried all the components everywhere, because when you have it nice and dry, then it doesn't leak. Mothers have forgotten and put it together wet and then been disappointed when it leaks. So the tubing fits right through and snaps right into place, so you know it's all set and ready to go. I didn't hear it snap. Let's do it one more time. There we go. So when you hear that snap, then you know it's ready to go. The cap screws right onto the bottle, nice and tightly. And when we pick it up and turn it upside down, it's ready to flow. Now, it has these little grooves here because obviously it's going to flow and you don't want it to get all over you when you're setting it up. So these little nifty grooves in the cap cut off the flow. And when you first set it up, if it doesn't flow and make the tubes look white, it could be that there's a little kink in the tube. You just look for it and rub the tube and the kink will open and it should flow just fine. Okay? So we're all set and ready to get it all set up for you. Now the neck cord has this little clasp on it that adjusts for the size. So we're going to put it over your head like this, and it hangs just like a necklace. Now I'm going to move this down, but I want to show you first that this locks into place by moving it forward like this, and you unlock it by moving it back. So we'll put it all nice and forward and lock it into place, and you're all set to go. Okay? Now it comes with tape, and I'm going to show you how to tape the tubing to your breast. When you're first getting started, it's a lot easier to tape it on because then you kind of have a little more control of the tube. So what I usually suggest is to put the tubing underneath your bra flap like this. Your bra flap kind of holds it into place. And we make the tubing just about 1/4 of an inch past your nipple. It needs to be a little longer because the baby's going to stretch your breast and nipple into his mouth, and that'll match the end of the tubing. And I usually attach the tape right where your nipple ends, and the areola, or the darker area around your nipple, begins. And this way, by taping the tube down on a line, the tube becomes a part of your breast. And that way, when the baby takes your breast, he gets you and the tube. It's a little harder for him to just suck on the tube that way. And what I'd like you to do is set him up on the other side. Let's see how you do. I'll get the tape ready for you. That's right underneath your bra flap. Make it about 1/4 of an inch. Now, one little trick, you know how it kind of sticks up? If you roll it so it kind of lays down. Isn't that easier? Okay, and then we got the tape right here. Sounds like baby Jeremy's getting ready, don't you think? Oh, Jeremy, are you ready? Hi, little guy. There we go. Now just go ahead and hold him in your arms. That's right. Slip your hands underneath your breast. I'm going to get this undone and all ready to go. Now, Robin, if they fuss a little bit when they first get started, it's because he's never done this before. He's been a little bit used to bottles, and they may fuss a little bit when they first go on. And just having some patience and guiding your breast and holding him and talking to him softly may be all that you need. But as you can see, he's nursing beautifully, and as we can hear, he's swallowing with every suck, so he's getting some of the milk through the tube. How does that feel?
Very good.
Well, there's some things I want to point out to you. We have the tape coming under his upper lip, and that seems to work the best. Sometimes if the tape gets into the corner of his mouth, he won't get as well a flow. If you don't hear him swallowing, remember to make that tubing 1/4 of an inch longer than your nipple, because sometimes if it's too short, they won't swallow either. Now, if we were going to put him in another position, and we'll leave Jeremy nursing for a minute while I show this to you. We have the tape taped over here for what we call the cradle hold. If you had to nurse him at your side, or what we call the football hold, we would have to position the tape differently on your breast so that it would come under his upper lip. Sometimes for cradle hold we swing it over here, and sometimes for football hold we put it straight down, so that if the baby's head were here, the upper lip, the upper gum would hit here and the baby's mouth would do it this way. You see that? This were the upper lip and he's nursing this way. We'd need it over there, which is where we have it. So whichever direction you have the baby, you need to make sure the tube comes under his upper lip. Isn't that easy? Okay. Now, when Jeremy's finished, and we want to let him go ahead and finish nursing, when he's finished nursing, we're going to need to clean the feeding tube device. And I have one here. Let's say we were finished. We would empty out all the milk that's in there. Now, some people suggest that you empty out everything that baby doesn't use. You might want to check with your doctor on that. and we fill it with some cold water. Now the reason we fill it first with cold is that when we're cleaning the water through the tubes, we don't want it to cook the milk that's in there. So we initially first kind of shake it, and you'd be doing this at the sink, of course, and you'd squeeze the bottle, and the water would carry the milk right through the tubes. Then undo it and pour it out. And then we can take some warm soapy water. Now I haven't put too much soap in here. There's more soap than it looks like there is in there. But you don't want to put too much soap in your soapy water, because then you'll be forever rinsing it out of those very thin tubing. So you want to put just enough soap. And what I generally do is put the soap in there ahead of time and mix it, instead of just pouring soap directly into the bottle. So you mix up your warm soapy water. Pour this in here. Again, put the tubes on. This is really easy. And flush the soapy water through the tubing. And you can kind of give it a good squeeze, and you can see the tubing still looks milky because there is soap in that water. And then empty that out. And then of course you would use your rinse. And so you use clear water for rinse again. And again, flush it through the tubes. Okay? Then you have it clean, and if you do that right after each feeding, then it's all ready to go. You really treat this just like any bottle. And many health departments say that we don't have to sterilize bottles anymore, but just to clean them out with warm soapy water right after use. About once a day, it is suggested that you boil this in the tubing, and you can put it in a pan and cover it with water and bring it to a boil and boil it for 20 minutes. And if that's done once a day, I think that's pretty safe. Of course, we've washed our hands before we assembled it. But let's say you wanted to put milk in it and have it ready for the next feeding. Well, you could do that. These tubings wrap around the top, and again you can put them through the nifty little grooves like that, and a cap comes with it, so it's ready to take with you to Grandma's house or wherever you're going. And of course it can be kept cool that way on the way, just like you would a bottle. One other thing that's quite clever is you can also obtain extra bottles with regular caps, so you can have these all made up in the refrigerator and ready to go. So when Jeremy's ready to eat, you have the ease and comfort of just taking this cap off, put on your tube cap, and hey, you're ready. So it can be quite convenient. Now, there's a couple other things I want to show you about the flow rate. As Jeremy gets older, let's say you determined that he got a little fussy and you felt he wanted a little faster flow. You can always determine that by how well they're swallowing. Most babies, when they're feeding well, will swallow with every suck. It kind of is a type of sound. And if he's swallowing with every suck, then you know the flow is just right. If he's swallowing every 3 or 4 sucks and not quite swallowing with each one, and you determine he might need a faster flow, you could go to the larger size tubing. But what if that made him swallow a little too fast? Let me show you something. You can open up the other tube. Now it won't leak over here on this side, even though you've opened it, because the tubes come down and up, and there's actually air coming in through this tube, which will help kind of push the milk out again. So it kind of prevents it from leaking on the other side. And that'll give you about 1/2 the flow of nursing with the other side closed. Now that brings another point. When do you open that for feeding? Now with Jeremy, we put him on, and then we open the groove to get the flow going. For a baby who likes to go on the breast and will suck anything, that's an easy thing to do. But if there's a baby who isn't quite sure that he wants to do this, we might want to open it ahead of time and have it flowing already. Oh, I think he really likes nursing. You think he's finished, or does he want a little bit more? Well, if he's finished, that's okay. We can put him over in the infant seat for a minute, because I want to show you one other little trick. Let's see if he'll act finished. Sometimes it's hard to tell if they're finished. And of course, burping him and putting him on the other side is helpful too. Why don't you leave him up there, and let me show you one other thing on this side while he's burping. Let's say you had a special need and you needed to have a really fast flow. You could take both of these tubes and put them side by side underneath the tape. Of course, when you move both of them over, it helps to put the tubes in the groove so that it doesn't leak. But if you take them side by side, like this, and put your tape on, then we could have a double flow. This would be for a special need baby. I find that the only time I've really had to use that would be with a baby with a great deal of difficulty suckling, such as in a cleft lip or palate or some type of situation like that. So this tube has a lot of variability of flow, which can be just tailor-made for each individual baby. Well, Robin, what do you think?
Thank you very much, Kitty. I think this is going to be great.
Well, I think you and baby Jeremy are off to a great breastfeeding relationship.
The first week home from the hospital can cause lots of worry as breastfeeding begins. Kittie makes a house call to a new mother of a 3-day-old baby and answers all of her many questions. How often should I feed the baby? Why does he seem to breastfeed so much at night? Should he be on a schedule? How can I tell if he's getting enough milk? Kittie's positive, practical advice is sure to get breastfeeding off to a fabulous start.